So over the next hour, you'll be hearing from 3 expert panelists. We have 2 of the 3 with us. I'm just waiting for our final panelists to join. So hopefully minor tech issues that will overcome there. And they'll each be sharing their experiences from 3 very different perspectives. So a patient advocacy group perspective, a medical technology industry perspective, and a personal perspective. Just turning to our panel, before you do speak properly, because we'll invite everyone to give an opening presentation, could I just ask you to introduce yourselves and the role, so the hat that you're wearing today? Ange, can I open with you?
Yeah, of course. So very happy to be here. Thanks for the introduction, Jess. So my name's Angie Bradshaw and I'm a project officer at Alzheimer Europe. Alzheimer Europe is an umbrella organisation, an NGO that represents a wide range of Alzheimer's associations from many different European countries. And our goal is to change perceptions, policy and practice to improve the lives of people who are affected by dementia. And I'm also involved in the core group of the Data Saves Lives initiative, which is one of the reasons why I'm talking to you here today. And I work on a number of rather data heavy projects around health literacy and data sharing. Very happy to be here.
Thanks so much, Angie. And Urosh, it's the first time we're welcoming you to a Data Saves Lives webinar. So could you please introduce yourself and the perspective that you're speaking from today?
Of course, thank you, Jessica. So my name is Uroš Bogdanović and I'm from Serbia, and I'll be sharing the patient perspective as I'm living with type 1 diabetes. I've been living with it for the past 12 years. I'm an active diabetes advocate, board member of the Diabetes Association of Serbia, so I have a little bit of insight into the patient organization perspective as well. And I'm European diabetes advocate for International Diabetes Federation Europe and the global young leader in diabetes of IDF.
So it's safe to say you wear a lot of different hats, because that's a long list of credits. So it's an absolute pleasure to have you with us. And
I'll make sure not to wear my attorney at law hat and getting all detailed into personal data protection and everything. I don't want to get into that today.
We may well be getting into that today, but let's see how the conversation
without me.
And our third panelist for our audience, who will be joining us shortly, so it's just tech issues. We know she's around, but she's just about to join, is Justine van den Bosch, who's the director at ResMed, so one of the companies that's part of MedTech Europe, who'll be providing that industry perspective. And we'll let her introduce herself properly when she joins. So in terms of the structure of today, each panelist will take the floor to deliver an opening talk before we open to a group discussion. What we do invite our audience members to do is please write your questions in the chat. And we can just see, we've got Justine with us now.
Yes, hi. I'm sorry, I had actually the wrong Zoom link, so I was listening to everybody introducing themselves, and here I am a little bit late. Sorry about that.
It's almost perfect timing. So yeah, Justine, do you want to introduce yourself?
Yeah, I'm Justine van den Bosch. I'm the Director for Government Affairs at ResMed, but also the Vice Chair of the Digital Health Committee at MedTech Europe, as well as the Chair of the Data Governance Working Group. So I'm quite, I'm quite across the issues that I've been in touch with Data Saves Lives before, and I'm really happy to be here. And I'm going to talk about the perspectives of the MedTech industry in terms of how we use health data and the environment that we are currently facing in terms of the new regulations that are coming out soon that will hopefully facilitate our solutions and innovations.
Thanks so much, Justine. It's fantastic to have you with us. We're just introducing to our audience members that there is a Q&A function as part of the Zoom webinar. So if you have any questions for the panelists as they speak and also in the group discussion, please pop them in the Q&A. We recommend that as you think of them, as the inspiration strikes you, even if we don't come to it immediately, we will do in the group discussion. So it'd be fantastic to know your thoughts there. There's also a chat function if you just had comments about your own experience that you wanted to share or agreements. So please do use those. The purpose of these coffee chats is to be fairly informal and share the views of our audience members as well as our panelists. The aim being that we leave today with a better understanding of the importance and role that medical technology has, how medical technology can be used to improve not only just personal health, but society's health outcomes, a little bit more on the mission of data saves lives and how it can be achieved, and what you, our audience members, whether representing the patient community or the medical technology industry, can actually do to spread the word and build trust in the process of health data sharing in your own communities. So, Ange, we'll be coming to you just a minute to discuss your perspective, some more on data saves lives. But I'd like to take a moment just to set out some context for today's webinar, which is to discuss, of course, the role of MedTech in health, but I think we can all accept more broadly that health data is instrumental in providing new ways to manage one's health and lifestyle. It can be integrated across a variety of platforms to enable better clinical care practice and also decision-making, combining health data from different sources in an appropriate manner, which is some of the topics that we're going to be discussing today, can empower people with that information and deliver more robust evidence for the efficacy of treatments. We've seen over the past decade that intelligent automation and also artificial intelligence can improve access to care and assist healthcare professionals with routine or repetitive tasks. And data-driven research and innovation can deliver benefits across the care spectrum, from diagnosis and speeding that up all the way through to cure. So in short, health data brings enormous benefits for people, healthcare professionals, and healthcare systems. So what's the catch? Trust. And I think that's a theme that we're going to be exploring a lot today. To truly harness the power of health data, it needs to be shared and used effectively. An important enabler for this is the awareness and understanding of the wider patient and public community as to why data is so important and how it's used. So building awareness through dialogue and sessions just like this with information provision and best practice sharing can foster trust in and cooperation for the responsible use of health data. And that really is the mission of Data Saves Lives, which Andy is going to speak to in a little bit from the perspective of a participating patient organisation and core team member. But we need collaboration with industry to realise our ambitions. And one of the major providers and users of health data are medical technology companies. MedTech companies provide products, services, and solutions that prevent, diagnose, monitor, treat, and care for human beings. They process health data both when doing research to develop new technologies and then part of their rollout in healthcare systems. And that's why we're so delighted to be working with MedTech Europe for this session, whose purpose is to make innovative medical technology available to more people while helping healthcare systems move towards a sustainable path. So, scene set. Angie, I'd like to pass the mic to you to speak more about the importance of data saves lives, but also some of the implications of health regulation like GDPR, which we hear so much about, and the wider topic. It's a lot to go into. I know you have a few slides of health data literacy, and that's really in terms of how citizens can make the best use of new technology, which is, I know, something that you've been working on a lot in your organisation. So over to you.
Thank you very much, Jess. I'm just going to share my screen. There we go. So I'm also going to just jump off camera, bandwidth issues. But so apologies for being a bit of a disconnected voice on this webinar. I'll come back on and, oh, sorry, let me just go back one slide in a minute. So as Jess just mentioned, I have quite a big remit here. So digital health, health literacy, and data sharing are huge topics to address, and I will not even be able to scratch the surface in 5 to 10 minutes. But I'll do what I can. And I thought that it would be good to start with some definitions, start at the beginning. So first of all, digital health is the use of digital technologies to improve health, as Jess just mentioned. And sources of digital health information can include mobile health apps, wearable devices, electronic health records, telehealth consultations. And linked to that Digital health literacy is defined as the ability of an individual to find, understand, and appraise information from these electronic sources, and then use that information to make appropriate decisions about their health. So there are many benefits of digital health, and you alluded to some of these in the introduction. So it can help prevent, monitor, and treat disease in the community and in a personalized way. So it allows us as individual patients to maintain a degree of control over the decisions that are being made for us and about us. And I'd say also, after the pandemic, digital health is increasingly prevalent. So I, like most of you, have a number of apps on my phone that help me manage my various COVID certificates and obtain results, for example, from test providers. And as a result, digital health literacy is becoming increasingly important, because low digital health literacy, or low health literacy indeed, is really strongly associated with adverse health outcomes. It can increase the costs of healthcare, and really importantly, it means that patients cannot adequately participate in health decision making for themselves. And like many health advances, those with the most need of them often benefit least from them. So some of the determinants of digital health literacy include age, health status, socioeconomic background, income, and ethnicity, just to name a few. And so the second thing I was supposed to talk about was data sharing. So where does data sharing come into this? Well, it's an integral part of most digital health platforms. The data that we provide via these apps can be shared with a range of different recipients. So you might imagine your healthcare professionals looking at your data, but also hospitals. But then you also have the cloud service providers, the databases that mediate this data transfer, and researchers as well. So health data is a huge boon for research, and it really allows informed policy-making decisions to be made. However, there are many barriers to data sharing. So the least of these are technical, but there are huge barriers when it comes to legal and ethical issues. There are opportunity costs and also privacy concerns that are really important to address. And as an organization, last year, Alzheimer Europe launched a report on data sharing in dementia research, aiming to understand some of these challenges and maybe think about identifying some potential solutions. So I just wanted to take a minute just to give you a little bit of background about our disease area, about our area of interest. So as many of you know, Europe is home to an aging population, and the number of people with dementia in Europe is likely to double by 2050 to over 18 million people. And dementia is one of the leading, if not the leading, cause of dependency and disability. However, research on dementia receives a low amount of funding compared to other disease areas, and you can see some figures there. So for every £10 in the UK in health and care costs, dementia receives 8p, compared to just over £1 for cancer. And those are 2015 figures, but they haven't changed a great deal since then. So we obviously need a huge effort to understand the causes, diagnosis, ways to prevent and care for people with dementia. And as a result, there's a really big need to maximize the utility of data from dementia research, because for the moment, there are no widely available therapies that can modify the progression or prevent the development of dementia. And data sharing as such represents a really important step to meeting these needs. So it helps us to get the best return on investment in research, and ultimately data sharing, it will enable the identification of cures, better diagnoses, and help us better care for people with dementia. So in our report on data sharing, we looked at a lot of different topics, but the one that's probably the most relevant to this audience and this webinar are the research participant and patient perspectives on data sharing. So there's been quite a lot of research on these in the past. And I think just to summarize it in a few sentences, we can fairly we can more or less say that most research participants have an understanding of the societal benefit that can arise from data sharing. And they understand that data sharing, when shared in a secure and ethical way, can advance research. But they often have very strong views as well on who they'd like their data to be shared with and how this data is shared. And linked to this, they have quite a good awareness on data scandals, such as you might have heard of the DeepMind scandal in the UK, where health records were shared with Google, who were supporting a company to develop an app for clinicians. And this has really damaged trust. So here we come back to trust. So trust is essential for ethical and involved data sharing. You need to have the trust of people whose data you are sharing in order to do that. And although regulations such as the GDPR, you know, the thing that makes cookies pop up on your computer every 2 seconds, but also does a lot of other good things actually. Although the GDPR has increased trust in data sharing, these and other scandals have damaged that trust. So it's a fragile thing, and it's revealed deep-seated concerns about particularly loss of privacy and the misuse of data. And as a result, our report showed that many research participants would like to be involved in decisions about data sharing, or at least know what is happening to their data. So where it goes, why it's going there, and how it's getting there. And this I'm just reaching to my final points, I guess, in this presentation, but these are some comments that came from a recent consultation that was held with patients. These aren't research participants, these are patients who are receiving routine healthcare in hospitals, and there was an event that was held by the NHS to ask about their views about data sharing. And you can see that misuse, whether it's out of hacking or misuse from people who receive data and don't use it for the reasons that patients might have donated their data or provided their data. So comments included, how can we be sure that no one will misuse these data? And highlighted some issues in particular communities. So in minority communities, there are still a lot of misapprehensions and concerns about medical records and data. And you know, are private companies using data or accessing data because of power and money they might have versus the need for clinical reasons? You know, we might trust the people we provide our data to, but do we trust who the data is being passed on to? And that really brings me to my final question. So research has shown that there's a general willingness to share health data for societal benefit. However, there's a degree of mistrust in the sharing processes and also in the protections that help protect misuse from data. And digital health literacy is important because it's an enabler for health and also for data sharing. It's underpinned by education, you need training and you need capacity building. And as a community, the question really is, how can we increase awareness of and understanding of data sharing and digital health and the values they bring or the value they bring, but also empower patients to make informed decisions about their health data? And this brings me to Data Saves Lives. So over the last 3 years, I've been really happy to see Data Saves Lives thrive and flourish as an initiative, starting from an initial investment by FPIA and led by the European Patients Forum and by Gözde Suzuzlu, who is on this call today as well, I think. And one of the things that we've been working on at Data Saves Lives is supporting patient organizations such as Alzheimer Europe to engage their audiences and communities in conversations about these tricky topics. It's not simple. You know, it's health data in itself is a challenging topic to address because there are many technical, legal, ethical, conceptual barriers to understanding the topic. So one thing that Data Saves Lives has done in the past year is developing a toolkit to help patient groups and individual advocates speak to their communities about health data and help people understand some of the benefits, some of the challenges, some of the risks, and giving them really the materials that they might be able to adapt and use to disseminate the message that data saves lives, and that data saves lives health data is a net benefit to society, but that we need to be informed and empowered in how it's used. So for anyone who's interested, this toolkit is available online. I think it's available in a range of European languages as well, really to increase dissemination. And we can maybe come back a bit later on to talk a little bit more about Data Saves Lives itself, the toolkit, and how it could be useful to different communities. I'll stop there. I will stop sharing and come back on camera as well. And I'll hand back to you, Jess. Thank you very much for listening to me ramble on, and I look forward to hearing everyone else's views.
Hardly rambling. Thank you so much, Andy. So many important points there, and I love that description of the net benefit of health data, because to your point around the scandal in the UK last year around the GP records being used privately, and there's a lot of coverage around where health data sharing goes wrong. but not so much about when it goes right. So we don't talk so much about those benefits to individuals and society, and that's some of the work that we're trying to offset through webinars like this, where we actually invite people to share best practice and understanding. And it actually, if we can shine a light on more of the good examples, then hopefully we get that balance. It's always an informed decision, and of course trust is built and lost on the experiences of individuals and how their data is used. So we need to work collaboratively to make sure that it is used well and responsibly. And more on that now from an industry perspective from Justine. I will just remind all audience members the Q&A is open. So if you do have questions based on what you've just heard from Angie or Justine now as she speaks, do listen there and we'll come back to them in the group discussion. But for now, Justine, the floor is yours.
Thank you, Jess. And Angela, thank you for your presentation. I'm really, I should applaud the Data Saves Lives campaign, which MedTech Europe really supports. And we're happy that there's a patient organization out there that's, raising awareness about the benefits of health data, because I think more of that needs to be done, especially in the context we are living in right now of the pandemic. I'm going to be kind of wearing two hats today, one, speaking as a MedTech Europe participant and one as ResMed, because I'm going to be talking about the specific solutions we provide, which were really well introduced already. So I don't know how much detail I can go into. But I just wanted to kind of set the scene by stating that MedTech is really at the heart of the health data ecosystem. Many of the companies that belong to MedTech Europe, they generate the data and use connected devices to gather data, not only from patient input, but from healthcare providers and also organizations like hospitals. And this is where, we are also quite well regulated in this respect, because a lot of the health data that is generated is very sensitive, right? So in terms of the comments that were made and the kind of concerns that patients have in terms of where is this health data going to end up and what if, it's misused? Let me assure you that the MedTech industry has a lot of regulation and compliance measures in place to make sure that we do not abuse this data. And as MedTech industry, we actually differentiate ourselves from any other kind of companies that may use health data for other purposes, like wellness apps, which are not really regulated under the MDR as we are. So I will now kind of take this to the introduction I have with regard to the types of data use that we have. So when data is actually generated by connected medical devices, it can be used either for primary purposes or secondary purposes. And primary use of data is usually delivering a digitally enabled service with a solution or platform that is supposed to be done in the service of the patient. So it can be like a patient engagement app, which allows the patient to kind of monitor their own treatment, or it gives a service to the healthcare provider who can look at a platform in the way that it measures the parameters of the patient's treatment, of the way the patient is experiencing his symptoms, and that is basically the primary use of data. Whatever health data is used to deliver the service to the patient for the therapy is considered primary use of data. Secondary use of data is actually the type of data that we use to take the data that's been generated by the devices to, and also from other sources, to basically embark on data-driven research. And also the second part of that is using that data to basically improve our platforms, our solutions. So anything that is aimed at measuring and improving efficacy and safety of the diagnostic device or treatment or care protocols. And obviously the second part is quite important right now, given that the implications of improved research through increased use and also availability of data have very wide-ranging benefits in terms of insights and a general awareness, as well as providing the basis for improving our solutions. And much of this is going to be driven by machine learning technologies and AI. So we are able to use the vast amounts of data that are generated for purposes of improvement and research. And when that data can also be, when device data can be combined with environmental data, I believe somebody already mentioned, or any sort of source of claims data, enriching that data set will also improve the insights that we can gain from that. In terms of the specific solution that ResMed has, it's with regard to remote patient monitoring. So ResMed is actually a company that specializes in providing solutions for sleep and respiratory disease. So we actually produce CPAP machines which are connected with a chip, and then the patient has a mask and is monitored through the way that he inhales during the night and whether he has sleep apnea incidents, and then those incidents are then recorded by the device, and then the data recorded by the device is sent to a platform, which is basically managed in a cloud platform by the healthcare provider. So in the moment that our devices kind of enable the primary therapy and the way that the patient uses the device, and then we generate the data and then send it to this platform, which is then managed by the data controller. So that's either the hospital or the actual healthcare provider. And this basically, this kind of remote monitoring enables our patients to detect the compliance pattern, the effectiveness and efficacy of the therapy, and any changes in the effectiveness of the therapy. And also through, looking at the platform and the data that's being analyzed on the platform, we can actually have the ability to predict if there's any patient that is at risk of terminating the therapy. So it gives us a lot of insight in terms of coaching, and also, following up with the patient when, the healthcare provider feels that he is at risk of terminating his therapy and also experiencing further complications. And a recent study has actually shown that remote patient monitoring has reduced the risk of therapy termination by 50%. So it's actually quite an added value technology, because it monitors the patient and enables compliance as well. And also the ability to kind of analyze this data on the platform kind of provides us with a risk stratification ability, where we can kind of manage many patients on a scale of who's at risk and who is experiencing more, or who needs to be followed up closely or sent to the hospital, while the other less risk patients can be kept safely at home. So as you can imagine, during the pandemic, this is very valuable, because it allowed many patients to still feel like they're supported by the healthcare provider without having to go on routine checkups to the hospital, which was already sending people home during the pandemic because nobody wanted to keep healthy patients in the hospital. So like I said, there's a lot of benefits to this type of technology and the use of health data in terms of improving patient adherence, keeping patients out of the hospital, and also reducing the deteriorations. And as well as for the healthcare providers and the hospitals, it enables them to kind of be more efficient in the way that they commit their resources and their staff, because they will only be, with this insight, able to follow up on the most at risk patients, rather than having routine checkups, which are not really, regularly necessary if the patient is doing well in therapy. So in that, like I said, there's many benefits of using the technology in health data, and increasingly in terms of research and innovation, moving on from the device benefits, data-driven research can improve diagnostics and treatments. It can help with detection and understanding of diseases and develop new treatments, and also provide insights for population management, right? And then basically, so there are many, many benefits for the patients, the healthcare providers and hospitals, as well as for research in terms of really creating the ideal environment which would enable more better treatment and outcomes for patients and healthcare systems. And also with patient apps, patient-managed apps, it allows patients to feel more empowered as well in the way that they are only allowed to monitor their therapy, but also engage with the apps personally to kind of enable their adherence and also insights. There are some kind of legal implications right now, which have already been mentioned in terms of privacy and policy that we are still trying to solve as MedTech Europe. There are, another regulation that we are, following is the General Data Protection Regulation, which has been in force for a number of years now, and it was aimed to basically harmonize the use and sharing of personal data across the EU. However, we found that a lot of the implementation and in practice use of the GDPR across member states has been very fragmented. And this can cause a lot of problems for industry, because with every different EU member state, there's a different practice, a different requirement for compliance and application of the GDPR. And it really increases the burden as well as the ability to provide one solution across a streamlined ecosystem. So because of this, it creates additional costs for compliance. So what we have been really asking, the politicians as of late is, how can we create a much more harmonized and predictable environment across the EU to enable the way that we share and use health data? And one of the potential solutions for that is going to be the European Health Data Space proposal, which we are hoping is going to come out in its final form in April. And the European Health Data Space provides some opportunities here for kind of providing a much more harmonized environment for the reuse of health data, for research purposes, and creating a regulatory framework which will provide the appropriate safeguards and specific requirements that have not yet been properly addressed by the implementation of the General Data Protection Regulation. And we're hoping that also the European Health Data Space proposal will enable some much more clear and standard specifications for interoperability, which will therefore help us scale the use of health data, but also for placing many digital health solutions on the market, and also provide and facilitate access to telehealth and remote monitoring services. And also, once this new European Health Data Space proposal is in place and the legislation is enacted, we are hoping that with this new regulatory framework, the trust element will also be improved, because obviously if we have a law guiding the sharing of data and the uptake of digital health solutions, and member states really implementing a Europe-wide ecosystem, that will improve the trust of the citizens and the patients in terms of how this is all being regulated, protected, and also safeguarded for the benefit of the population and the healthcare system. So I hope I gave a good enough overview of the kind of challenges and opportunities we are looking at and we are providing, and I'm happy to answer any questions at the end. Thank you very much.
Thanks so much, Justine. Yeah, some great insights into the responsibility of being a company that processes that data and how to make best use of it, and then some practical examples in terms of seeing how that works in the clinic and for the ultimate benefits of patients too, so that they can use the data. I think a lot of us would be reassured, particularly in the pandemic, as you say, to know that you are being monitored albeit remotely, so that if something goes wrong, then someone will know about it and will alert something in a system somewhere, which probably is a nice tie to our final speaker, Urosh, who introduced at the start of the session that he's living with type 1 diabetes and therefore is a MedTech user himself in terms of the management of his condition. So, Urosh, I'm going to hand over to you, put you in the spotlight frame for everyone, and invite you to share really what we're all here for, which is to improve individual patient experience and overall health benefits. So over to you, Urosh.
Yes, thank you very much, Jess. As I already said, I'm very pleased to be speaking on this panel with these speakers on behalf of the patients and sharing a kind of not only personal, but personal and the perspective and experience of other patients and patient advocates who regularly use medical and digital data in their day-to-day lives living with type 1 diabetes. And type 1 diabetes, I think, is a perfect example of a disease, of a condition that can really benefit so much with the use of data, of more data. And I think that in the past 10 years or so, there have been major leaps in getting more and more data to the patient and to the healthcare provider with regard to the day-to-day condition living with type 1 diabetes that have made tremendous improvements in the life of people with diabetes. And personally, I would like to emphasize the use of so-called CGMs, which is short for continuous glucose monitors, which have been around for quite some time, but in the past few years have just, I think they are reaching their full potential and getting to more and more patients by the day. And I will definitely try to stay out of the question with regard to access to those new technologies and new data. That is a whole different topic, but is an extremely big issue that we are facing. But supposing that we do have access to these devices, I would like to emphasize the importance of education in how to first choose the appropriate device for each individual patient. That has to be done on a personal level with that patient and his or her healthcare provider, because there are on your market, there are a lot of different devices available, and you should be able to make the most informed decision on which one to choose, because there are so many differences. And once you choose the device, you should be able to know all the tiny little quirks and features and different bits of it, because there are so many things that can impact the quality of data that you gather using that device, which is, it is communicated in a way. You have to go through official training with your HCP, with the company that is actually providing you with that device that is making it. But a lot of it has to do with the personal experiences of people who have actually used that device in their diabetes treatment for some time. And I want to share just a few differences between those devices and something that you would have to know when you are using them, and to see whether that data you are collecting is actually as correct as possible. So for instance, I've just read an article 3 days ago from a diabetes advocate mentioning that one of those devices actually uses chemical technology that is very, very, very susceptible to vitamin C, to the amounts of vitamin C in your body. And it is official data that it shows that that device is quite unreliable when there are raised levels of vitamin C in your body. Meaning that if you take, for instance, vitamin C tablets on a daily basis, or you drink a lot of fruit juice, for instance, that can lead to that device being pretty much unreliable and not a good fit for you. On the other hand, you have devices which are, for instance, sensitive to water or sensitive to levels of hydration in your system, meaning that if you generally do not drink a lot of water during the day, that device can actually project higher glucose levels than they actually are, because it relies a lot of the level of water in your body. There are devices that are sensitive to heat changes, so they would show a huge spike in glucose after you've taken a hot shower, which is completely incorrect, but you have to know those specifics. And I think that is one of the reasons that patient organizations which gather a lot of people and can share a lot of experiences of different people in using those devices. I think that is very important to know which device to choose and how to get over those tiny little bits and quirks that those devices offer. On the other hand, the second point I wanted to make is with regard to implementation of a system that maximizes the use of that data collected. And Justine mentioned the different systems they are putting in place in connecting the healthcare providers and patients and having the opportunity to have virtual checkups, in fact, which have been very important in the past few years. I wanted to say months, but it's coming to years, unfortunately. And I would like to share that here in Serbia, we have also implemented, the healthcare providers and the system have implemented a system that actually asks for the patients to read all that data and to upload them to a server used by the company that is providing the devices. And then the healthcare provider can access that data, and you can actually have a phone chat looking at that data at the same time from different rooms, from different places, and have some small adjustments to the treatment itself, and all in all, in order to improve your condition at that moment. But I would just like to emphasize, I would be coming too close to the end. In the end, I think those checkups and using that kind of communication between the healthcare provider and the patient cannot replace the physical meetings that you have to have. I'm speaking from a personal perspective, from perspective of a person living with type 1 diabetes, because in the end, those patients are people, they're not just numbers. So even though they have, even though that data that they share with you shows tremendous results and looking like everything is going well, sometimes you can see on that person that they've been dealing with quite a lot of different issues in their day-to-day life and day-to-day treatment. So in the end, I think those virtual checkups can help a lot, but only as an intermediate between two physical meetings and two physical checkups. And in that way, they can help us tremendously, because we would have more frequent visits to our physicians and make the best use and make the most of the data that we have, and to make our lives better by the day. So thank you.
Thanks so much, Uroš. And it's such an important point to end on, because we want Health Beta to amplify and improve care and enhance those conversations rather than replace those conversations. And it's a really important thing to remember, because we can measure more and more, but it needs to be with purpose. And I think everyone's actually touched on that in different ways, is why are we collecting this data, for what purpose, and how is it being used, is so important as we are in this time where technology is accelerating so quickly. It's just important to think about how we keep up with it. Conscious we've got 15 minutes left, and there are so many themes that I'd like to explore with all of you. So I think we can think about how we bridge and pull out the most important points that people want to discuss. I do want to just alert to a conversation in the chat for audience members who haven't seen it, which was a question that appeared while Justine was speaking, which is about, with the volume of data that can come through for remote monitoring, you know, are healthcare professionals ever afraid of the added responsibility that they have to pick up all this data and analyze it out of hours in case there is an early sign? And Angie, you pulled out some great points in the chat. I don't know whether it would be nice, just Andy, to come to you to elaborate those in person, and then maybe Justine come back to you to understand your thoughts on that from a medtech provider perspective.
Sure, thanks, Jess. Yeah, I think it was a really important question, and I think it can be unpacked in a couple of ways. So one point that's probably important to make is that we talk a lot about health literacy and digital health literacy, and there is maybe a certain level of assumption that this is not something that is an issue for healthcare providers and healthcare professionals, when actually it is. You know, that there's a huge volume of e-health apps, m-health apps available out there. There are new pieces of legislation that have been created to manage and standardize and help create an ecosystem in which those tools can be used in an effective way. But often, you know, things are moving so quickly that often that pace of progress isn't always translating to those applications and tools providing active support for clinicians on the ground. And ultimately, as Urosh mentioned, what a clinician will want is a tool that supports the decision-making process, but doesn't replace it entirely anyway. You know, so you have the sort of the technical challenge and the education and health literacy related challenge, but also how do you actually use this in practice? What are the practical applications? What are the obstacles? And how can we make sure that these tools that can be very beneficial are used in a way that is truly beneficial to patients? And that has to involve developing those processes, has to involve clinicians as well as the patients.
Such a good point. So you're not just putting technology on people, but it's actually being designed with those users in mind. Justine, can I ask if there's anything you want to expand there, just from your experience of that very issue?
Yeah, of course. Well, as a digital health company, obviously, when we develop new solutions, we go to great lengths to provide training to the people handling our technology. So, you know, that is a big part of our outreach also to the healthcare providers that manage the devices that we distribute. And I also wanted to mention about the patient experience. There's, you know, you cannot just, you know, put a new device on his bedside and say, okay, now it's your solution and good luck. We actually have to streamline the experience in such a way as to engage the patient willingly, that they actually want to use the technology. So, you know, we are actually including a lot of software within our devices that helps coach them along the journey. And we try to make it as user-friendly as possible. So it's not only on the healthcare provider side, which I know sometimes they feel like it adds, you know, a burden on their workload. But also it's important for the patient to be well prepared with the technologies that we put at their hand and at their solution. So we are increasingly trying to develop software solutions to enable that sort of engagement for the patient and also the insights that they get. So it's a big part of our work as well.
Thanks, Justine, for expanding on that. I suppose it ties me into a question for all of you, really, is looking at the opportunities and challenges that we've discussed. What do you think are the greatest levers that we can use, really, to make sure that we do realise the potential of health data and medical technology in particular for those people who can use it? What are the biggest changes or opportunities that we can take advantage of in the next 5 years to really see improvements in adoption across the board? And Ura, shall I come to you first?
Well, I think that we should focus on, as I said, access to those devices and access to that data, but also reflecting on what Angela and Justine said on the previous question, but it's very relevant to this one as well. Education and collaboration and communication between the patients, the healthcare providers, and the medtech companies. I think it has to be in that way, because as Justine mentioned, you can put out a device and tell the patient to use it, but if they don't feel comfortable in using it, if they don't know the advantages that it will bring to their treatment of their condition, it's of no use. So I think those are the two main points that have to be implemented: access to more people and education of everyone on what it can bring and how to use it in the best way possible.
Thanks, Urash. Really loving the themes of collaboration and education coming through. Angie, what are your thoughts on that?
Yeah, absolutely agree with everything that Urash just said. And I think in terms of collaboration and communication, we're moving towards a situation now where companies and researchers are more and more aware of the importance of involving patients and different stakeholders really from the get-go. So this is not creating a solution and then going, okay, now you guys have it and have a play. It's really getting people involved from the very earliest points of inception, thinking about design, thinking about approach, thinking about the data that's used and how it's shared. And I think that having that collaboration is essential, but also making sure that everyone knows how to practically enable that. So it's a good thing, everyone agrees it's a good thing, but it can be actually challenging to implement in practice. And really learning how to meaningfully involve different voices in the development of digital solutions, and then sharing that knowledge of how to do that involvement with other companies and with new research initiatives as they come through the pipeline. So we have sort of a community of practice with an engaged group of stakeholders who are there to be consulted and provide their views.
Thanks, Angie. And big believers in best practice sharing, I think, in terms of the two organisations behind this webinar. Obviously, the European Patients Forum is just that, to share those examples of best practice and empower and upskill patient communities in all different types of therapy areas that you might not necessarily put together. And then similarly with MedTech Europe, you've got a kind of industry neutral, working with a lot of private companies to do just that and to make sure that everyone's putting their best foot forward, at least trying to. Justine, for people on the line who might be representing other medtech companies, what would you say are some of the best ways to innovate in this space when it comes to collaborating with patient communities and citizens who might use your products?
Okay, well, I'm going to speak from the MedTech Europe perspective, because we are trying to influence the wider, broader ecosystem of regulation that basically governs the way that healthcare providers, hospitals, healthcare systems, patients interact with these new technologies coming on board. And as you've known, the pandemic has really accelerated the adoption of telehealth as well as digital health solutions. And now we're at a point where we need to actually have the regulation that will facilitate this uptake rather than make it more complex, make it more burdensome. Because if we don't have the ecosystem that enables the opportunities for patients and also for us to innovate and the patients to utilize these solutions, we have a long way to go. So we're hoping that policymakers will open up access to data. They will facilitate health data sharing, and also work on interoperability that will bring the solutions to the patient. And the member states as well will adopt increasingly reimbursement mechanisms that will put these solutions in the patient's hands without a burdensome, cost individually. So it's really on the systemic level that things still have to be addressed and solved for this, so we can all benefit.
Thanks, Justine. I think, yeah, to your point, it's changing all the time. So regulations to keep up with the advancements in technology and the ethical questions that come out of that is something that's going to be continually evolving. Orosh, I'm not going to come to you on that because I know you don't want to speak from a personal perspective. But in the last 5 minutes, I thought it would be great just to address, and apologies because I'm springing this on our panelists, and it's not a question we shared in advance, so they won't be prepared for. But all of this talk has really made me think about, what does progress look like in this field? So if we were holding this webinar in 10 years' time, what would you like to see that's different? So that we can all actually think about how we might move towards that as a follow-up from this webinar. So I'll come to each of you as to your positive vision of the future in 10 years' time when it comes to adoption of MedTech and trust in health data. So Orosh, can I come to you, particularly thinking about, you've had the most personal experience of using MedTech out of our panel. What would you like to see in 10 years' time?
Okay, putting me on the spot here, but I don't mind, of course. I keep coming back to it, but obviously, looking at in 10 years' time, I would like to see that we have so many different solutions, so many that are tailored to specific types of people, specific usages. And those people actually having the option to choose. So again, coming back to access to those devices and that data. And finally, I think I would like to see improvements in those devices that would actually be able to make a lot more decisions on my behalf rather than myself. I think that is something that has been going on. With those are called closed loop systems, where you have a glucose monitor that continuously measures the glucose levels in your body, connected to an insulin pump, which delivers insulin to your body.
I think we just lost.
How much it needs at that I hope to. Can you hear me?
Orosh, I was afraid we just lost you towards the end there, but really love the messages that we did hear in terms of the personalization of care and having that technology actually work for the individual rather than making more effort on their side. So that's wonderful. Thank you. Justine, from an industry perspective, where do you see the greatest opportunity for improvement in 10 years?
Well, our dream state is really about unlocking the health data and really being able to combine different data sets across, borders and across different research bodies, and also public data as well as industry, to basically unlock the technologies that can enable predictive, preventative, and personalized medicine. So anything that will make it much more personalized for the patient to actually realize, this is really my state of therapy, this is my state of my disease, and this is how I can enable it and get better insights to share with my doctor, and my doctor to have better data at his hand to improve my treatment. And also, being able to use that data for predictive purposes. Why should we lead the patient to such a dangerous outcome if we can actually use data to predict and prevent some of that deterioration happening. So really kind of enabling the health data that can provide better solutions and innovation and insights as well.
3 very powerful P's there with prediction, prevention, and personalization. That's great. Angie has 1 minute left to summarize. Will there be a need for data saves lives in 10 years' time, do you think, or will everyone be totally educated on this topic?
Oh, I think there'll There will unfortunately always be a need of data saves lives, but there's a good reason for that, and that's because progress is advancing and accelerating at such a pace that everyone always needs more information and more education on how these developments are working. And I think my final call would be to make sure that no one's left behind. And this is not just in terms of access to the devices, but also thinking about the data that is used to develop the algorithms that underpin those devices and those solutions. Unfortunately, a lot of the cohort data and research data is generated from pools of participants that don't represent diversity. And I think that's a fundamental challenge that needs to be addressed face on. And once we have solutions to those types of issues, I think we can make sure that those devices, which will hopefully be in the hands of a diversity of patients, can truly benefit them and benefit their personal circumstances and situations.
Thank you, Angie. I think that is a wonderful point to end on, and the role of collaboration from a lot of the stakeholders who'll be listening in to this webinar today. I think that is a great goal to have, actually make sure that no one is left behind and that the communities that need and can benefit from technology the most are involved in their development. Thank you to everyone. This is the fastest wrap up ever, and I know we could talk on, and actually, hopefully this is just the beginning of a conversation rather than just one moment in time. So I want to hugely thank the panel for dedicating their time and bringing such interesting conversation to us all today. And thank you to everyone for joining in, because you too, as audience members, are part of the solution when it comes to spreading awareness and raising education and health literacy levels for health data. So thank you so much, and wishing you a wonderful rest of the day wherever you are.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye.